Hi all, so in this session let's learn one CPC pattern question as well. This will be helpful for your live coding also. So here patient is coming with the hernia in the inguinal area and which is an incarcerated. So hernias we have like incarcerated, triangulated, thrombosed. So this is incarcerated and the patient's age is 55 years old. So what provider is doing for this hernia? First of all, what is hernia? Hernia is nothing but it's a protrusion formed from the body. See here you can see umbilical hernia, inguinal hernia based on the location where it is forming. Like if let's take like umbilicus area, it is forming the protrusion, so we call it as a umbilical hernia. If it is forming in the inguinal area, so we call it as a inguinal hernia. In the femoral area, femoral hernia. So like this, based on the locations we have the types of hernia. So the provider is reducing this hernia, nothing but like he's removing the hernia and he will reduce. So whether he's doing this procedure or not, let us see now. So here there is a huge hernia and then the provider he has taken the patient to the operating room and then what he is doing, so he made the patient to place in one position, that is Trendelenburg position, and then here the provider has started the incision in the inguinal area and then he carried down the dissection till to the area where the hernia is there, and here if you see he has encircled the hernia and then we have to check for the main terms whether he has dissected, removed, like this words you have to see in the report, operative report, or in the question you have to see this main terminologies. So this is the general kind of header they will give in the operative room, like patient is placed in so and so position and they have given the anesthesia, like that. This is a general common thing. Main thing you have to see is what, whether they have removed, dissected the hernia. Okay, and sometimes he will also place the mesh also. So mesh you can see here like this, they will place the mesh after removing the hernia. Why they will place this mesh? Because in order to like not to reoccur the hernia, so they will place this mesh. Okay, so here if you see the hernia sac was gently dissected. Dissected means what? Removed. So he removed and then he reduced the hernia and then he placed the mesh. Okay, so like this we have to see the main terminologies and then finally they will use the sutures to close that area. Once this area is like opened, they are removing, they have to close this area, right? So they will use the sutures. So the names of the sutures they will document like vicryl, monocryl. Okay, so these are the names of the type of the sutures. And then next, if you see the options here, option A is what? 49507. This is what? Repair initial inguinal hernia. Age 5 years or old, incarcerated or strangulated. Yes, the provider is doing the inguinal hernia repair only. And if you see what is the age in our question, the age is 55 years old. Yes, it is matching our scenario, right? 5 years or older. And then initial hernia. So whenever you are coming across the hernia, you have to check for the initial recurrent. Initial means it is like having the hernia for the first time. Recurrent means it is coming again and again. So that is a recurrent. Okay, so now in a documentation we don't have recurrent, so it is only documented inguinal hernia. That's it. It's like we don't have the documentation. Previously patient had the inguinal hernia where we can take a recurrent, but it is not there, so you have to take it as a initial. And then we do have that it is a incarcerated, strangulated. So we have incarcerated. Okay, everything is matching, right? So 49507 is the correct answer. Okay, fine. We are like considering this as the correct one, but we do have to check for the other options also. Immediately don't be in a rush and go with the first option. Okay, you're getting the answer, that's fine, but we do have to check for the other three options also. Okay, next 49521. If you take this is recurrent. Okay, any age, incarcerated or strangulated. Now, did they mention that this is a recurrent? No, right? So our option B is not the correct answer. If you take 49525, what is this? This is a repair inguinal hernia sliding any age. Did they mention like sliding? No, right? So this is also not the correct answer. Next, if you take 49507, already we have like selected in option A, but they have given another CPT code, that is 49568. If you see the descriptor of 49568, this is the mesh placement CPT code, and then this code is being deleted. Why? Because whenever hernia repairs the provider is doing, it is always included. So mesh placement you should not code separately. Please make a note of it. Even in the live coding, or if you are going to write the CPC exam, don't code the mesh placement. See, I already shown you the picture also. See, this is a mesh placement. After removing the hernia, the provider will place the mesh. Why? Because in order not to reoccur the hernia again and again, so for the safer side, they will place this mesh. If you see here, they have placed. The mesh was placed. The mesh patch was placed. Okay, don't code it again and again. You can make a note of this. Whenever hernia repair is done, mesh is placed. So you should not code it separately. Here in option D, we have like two options. No need to select this. Now, what is the answer? Option A is the correct answer. So in this way, we have to rule out in the exam. Not only exam wise, I am telling, even in the live coding also, this will be helpful for you. In the next session, we'll see more CPC pattern questions, and also like if you have any doubts, you can text me. And if you like the video, please like, share and subscribe to my channel.